Let's dive right into this explainer. Today, we're taking a fascinating and honestly, a highly practical look at the aging process. We aren't just talking about abstract medical concepts here. We're translating heavily researched medical guidance into a literal daily survival guide for managing age-related health changes. We're going to take the science of aging and turn it into something you can actually use to empower your day-to-day life right now. So, let's get to it.
Here's our roadmap for today. We'll be navigating age-related health, looking at medication safety for seniors, living with low vision, understanding essential tremor, and finally, taking control of aging. Section 1. Navigating age-related health, building your daily toolkit.
You see, aging isn't one big, sudden event. It's more like a series of small, daily adjustments. And knowledge is absolutely power here. By taking authoritative government health data and turning it into actionable steps, we can confidently take control of our daily routines. We really shouldn't be intimidated by the changes our bodies go through, because when we understand the actual mechanics of what's happening, well, we can adapt our environments and our habits. It's all about shifting from a reactive mindset to a totally proactive one.
So, let's start the day. Imagine you wake up, head to the kitchen, and like a lot of older adults, you're immediately faced with an entire counter full of pill bottles. You've got a pill for blood pressure, a supplement for bone health, maybe something for cholesterol. It can be incredibly overwhelming. So what happens when your morning routine involves such a complex mix of prescriptions?
Section 2. Medication Safety for Seniors, following FDA guidance. To help manage this exact daily regimen, we're pulling directly from the FDA's Consumer Updates on Medication Safety for Older Adults. The FDA provides 5 really essential safety tips to help you and your caregivers prevent adverse reactions. First up, keep an active list of literally everything you take, and yes, that includes over-the-counter vitamins. Second, actively review that list with your doctor at least once a year just to make sure you still need all of them. Third, take medications exactly as prescribed. No skipping doses to save money. Fourth, be hyper-aware of potential interactions, especially with food or other supplements. And finally, make sure you store and dispose of drugs properly. It's a brilliant, straightforward checklist that can instantly organize a chaotic morning routine.
But let's build on that scenario for a second. You've got your meds perfectly sorted thanks to the FDA's tips, but then you realize the tiny text on those prescription labels is getting harder and harder to decipher. You find yourself holding the bottle further away, and the kitchen light just doesn't seem bright enough, no matter how many times you wipe your glasses. Which brings us right to our next daily hurdle.
Section 3. Living with low vision, National Eye Institute Insights.
Turning to the National Eye Institute's official guidance, the absolutely crucial point here is understanding exactly what low vision actually is. Now, this isn't just about needing a stronger pair of reading glasses. Low vision is a specific visual impairment that makes daily tasks distinctly difficult. And, importantly, it cannot be fully corrected with regular glasses, contacts, medication, or even surgery. It's a permanent change in how you visually interact with the world. Notice the really clear distinction here between typical age-related vision changes and clinical low vision. Normal aging vision is just that familiar presbyopia, needing reading glasses or wanting a brighter lamp to read the morning paper. Low vision, on the other hand, involves profound changes like blind spots or a severe loss of your central or peripheral vision. Understanding this comparison helps us know precisely when we need to stop buying cheap drugstore reading glasses and start fundamentally adapting our environment with things like magnifiers, high-contrast labels, and targeted lighting. Okay, so you've managed the medication, you've adapted to the vision changes, but moving further through our morning routine, let's talk about the physical changes that can cause a lot of unexpected anxiety. What if you sit down to finally enjoy breakfast and you experience a tremor while trying to drink your morning coffee? Your hand shakes, the cup rattles against the saucer. Honestly, it's an incredibly common and completely understandable scenario.
Section 4. Understanding essential tremor, Medline Plus information.
To demystify these physical changes and remove the panic that often comes with them, Medline Plus defines essential tremor as a nerve disorder characterized by uncontrollable shaking or tremors. These are often most noticeable in the hands and arms, especially when you're actually trying to do something with them, like holding that coffee cup. Defining this specific neurological condition is truly the first step to removing the fear of the unknown. And it's incredibly important to differentiate essential tremor from other conditions people naturally fear, like Parkinson's disease. Notice the stark contrast in these two scenarios. Essential tremor typically occurs during action, so that's when you are actively using your muscles to hold a cup or write a letter. Parkinson's tremors, conversely, generally occur while the muscles are completely at rest.
Understanding this distinct difference brings massive peace of mind. It allows you to approach your doctor with clear, calm observations about your symptoms, rather than sheer panic.
Section 5. Taking Control of Aging, the Empowered Toolkit.
Look at what we've accomplished today. We've logically navigated morning medications, decoded the reality of low vision, and demystified essential tremors. We're proving that while the body undoubtedly changes, we absolutely have the tools and the structured knowledge to adapt right along with it. I want to leave you with this final, provocative thought. Are you updating your daily routines to match your body, or are you just fighting against it? This information from the FDA, the National Eye Institute, and Medline Plus isn't just trivia, it's a blueprint for adaptation. So how will you use this information to adapt your environment, organize your space, and empower your daily life starting today? Thank you so much for exploring this explainer with me, and keep learning.